Hi, good morning Elaine. My name is Enia Wynn. I'm your invigilator for the OET speaking session on the 9th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Elaine Moore.
And what is your candidate number, please?
My candidate number is 232212242.
Thank you. And you are taking this test as a doctor. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you interact positively with support staff?
As a physician, I understand that the support staff, such as nurses, CNAs, and administrative professionals, provide essential care to patients and deserve to be treated with respect as members of the health team. I make sure to get to know the individuals on the support team so that I can encourage them to provide the best care possible, and also to pay attention to their expertise and the information they get from their interactions with patients.
Why doctors should learn communication skills?
Good communication skills are an asset in medical practice. Effective communication wins the physician the confidence and compliance of patients and helps build a healthy doctor-patient relationship. Communication skills play a major role in developing patient-doctor relationships. And miscommunication could lead to interruption with medications or medical procedures, and can even cause clash with relatives or friends of the patients over the care given to the latter. The essential communication soft skills can be learned during the formative years and practiced to perfection over the years.
What steps do you take to prevent medical malpractice?
I take my job very seriously, and so I do my best to get a broad understanding of the symptoms through communication with my patients, examinations, and further testing. I feel that it is also helpful to consult with other physicians in cases where I am not certain of treatment, and I am careful to refer patients to specialists for matters outside of the typical scope of my practice.
How do you remain current in your medical training?
To remain up to date on the relevant research in my field, I attend yearly conferences in internal medicine, and I maintain a current subscription to CCP Internist to receive news about the internist community and information about clinical issues in internal medicine. I make sure to follow the latest studies that affect internal medicine as well.
Who is a specialist doctor?
Some doctors specialize in a certain kind of medicine. These physicians are called specialists. They may only treat injuries to a certain part of the body, or only treat patients who have certain diseases. For example, there are physicians who specialize in diseases of the stomach or intestines. Other physicians are general practitioners or family practitioners. This means that they do a little bit of everything. They try to deal with as much of a patient's health problems as they can, without sending them to a specialist. A doctor who performs surgery is called a surgeon.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good evening. My name is Elena Moore. I am your GP today. May I know your name for the record, please?
Good evening, doctor. My name is Xenia Wynn.
Hi, Xenia. May I know what makes you here today?
Doctor, my baby is not well. I think he is suffering from gastroenteritis.
All right. May I ask you a few questions to get more details about the child's condition, please?
Sure, doctor. You may please.
Thank you. If you don't mind, can you please explain to me the symptoms you have noticed?
Doctor, in the last 24 hours, my baby has had diarrhea 8 to 10 times.
Oh, I see.
And has also vomited twice.
Is he urinating well?
Yes, doctor. He is urinating regularly but is crying more than usual.
Any other symptoms like fever or something?
Yes, he has a fever, and is coughing. And also he has apparent soreness in the nappy area.
From the symptoms you have said, I can confirm that your baby suffers from a bowel infection and has led to gastroenteritis.
Doctor, I am worried that the child is becoming dehydrated.
I can understand your concern. Don't be worried. It doesn't seem like dehydration. However, dehydration can be prevented by giving a special liquid called an oral rehydration solution, ORS, over the course of a few minutes.
Doctor, I am very much concerned about whether the medication is appropriate.
Your concern is sensible. However, medication is inappropriate at this stage. The first to address this situation is dehydration. The lost fluids while vomiting and diarrhea should be restored. The restoration of lost fluid in the body is called rehydration. Gastrolite, or equivalent saline glucose solution, is necessary in this stage.
Okay.
Start the rehydration process by giving your child 1 or 2 teaspoons of an ORS every few minutes. This may not seem like enough fluids to rehydrate your child, but these small amounts can add up to more than a cup. That means 237 milliliters an hour. If your child does well, you can gradually give bigger sips a little less often.
Sorry, doctor. Could you please repeat it? I panicked a bit and I couldn't follow you.
No worries. I will explain it to you.
Thank you, doctor.
Don't panic, Xenia. Your baby will be all right. Listen to me. To restore lost fluid and prevent dehydration, you should provide your child 1 or 2 teaspoons of ORS, about 5 or 10 milliliters of an ORS every few minutes.
Will that be enough, doctor?
This may not seem like enough fluids to rehydrate your child, but these small amounts can add up to more than a cup, 237 milliliters an hour. If your child does well, you can gradually give bigger sips a little less often.
Okay, doctor. I got it.
Even kids who are vomiting can usually be rehydrated this way, because the small frequent sips get absorbed in between the vomiting episodes.
All right. But doctor, is it okay to breastfeed him now?
A breastfed infant should continue to be nursed, even during rehydration, unless vomiting repeatedly. Give the ORS in between feedings.
Sure, doctor.
You are following me, right?
Yes, it is clear for me. You may please continue.
Do not give a dehydrated child water, soda, ginger ale, tea, fruit juice, gelatin desserts, or chicken broth. These don't have the right mix of sugar and salts, and can make diarrhea worse.
Oh, I see.
When your child is rehydrated, you can serve a normal diet, including breast milk, formula, or milk.
All right.
For your information, some dehydrated kids do not improve when given an ORS, especially if they have explosive diarrhea or are vomiting very often. When fluid losses can't be replaced for these or other reasons, a child might need to get intravenous IV fluids in the hospital.
Oh, is it?
Yes. But mostly ORS will be enough. Perhaps, pay attention, and if required, contact the hospital immediately.
Okay, doctor.
I hope I am clear to you. Don't hesitate to contact us if you have any further clarifications. I wish your baby the warmest and quick recovery.
Thank you, doctor.
You are very welcome.
That is the end of your OHE speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.